Hello, everyone. Welcome to Health Basics, your guide to healthier living. In today's video, we are going to talk about one of the most vital organs in our body, the kidneys. The kidneys are two bean-shaped organs that are located on either side of your spine, just below your rib cage. They are responsible for filtering your blood, removing waste products and excess fluids, regulating your blood pressure, balancing your electrolytes, and producing hormones that affect your red blood cell production, bone health, and metabolism. However, sometimes the kidneys can get damaged due to various factors, such as diabetes, high blood pressure, infections, and medications. When this happens, the kidneys cannot function properly and may lead to serious health problems, such as chronic kidney disease, kidney failure, or kidney stones. Therefore, it is very important to take good care of your kidneys and prevent or treat any kidney damage as soon as possible. One of the ways to do that is to drink plenty of fluids, especially water, to keep your kidneys hydrated and flush out the toxins. But did you know that there are also some herbal drinks that can help repair your kidneys and improve their function? Yes, that's right. In this video, we are going to share with you 5 herbal drinks that can benefit your kidneys. We will also tell you how to prepare and consume them. So without further ado, let's get started. Number 1. Cranberry juice. The first herbal drink that we recommend for your kidneys is cranberry juice. Cranberry juice is a popular remedy for urinary tract infections, or UTIs, which are infections that affect your bladder, ureters, urethra, or kidneys. UTIs can cause symptoms such as burning sensation, pain, or blood in your urine, and can damage your kidneys if left untreated. Cranberry juice can help prevent and treat UTIs by preventing the bacteria from sticking to the walls of your urinary tract and flushing them out with your urine. According to a study published in the Journal of Urology, drinking cranberry juice can reduce the risk of UTIs by 32% in women with recurrent UTIs. Another study published in the Journal of Medicinal Food found that cranberry juice can reduce the levels of inflammatory markers in the urine of patients with chronic kidney disease. Moreover, cranberry juice can also lower the risk of kidney stones, which are hard deposits of minerals and salts that form in your kidneys and can cause severe pain and blockage. Cranberry juice can prevent kidney stones by reducing the amount of calcium and oxalate in your urine, which are the main components of most kidney stones. To prepare cranberry juice, you will need fresh or frozen cranberries, water, and honey or sugar to taste. You can also add some lemon juice or ginger for extra flavor and benefits. To make the juice, you will need to boil the cranberries in water for about 10 minutes until they burst and release their juice. Then you will need to strain the juice and add honey or sugar to sweeten it. You can also blend the cranberries with water and honey or sugar to make a smoothie. You should drink about 8 ounces of cranberry juice or smoothie per day, preferably in the morning or before meals. However, be careful not to drink too much cranberry juice, as it can cause some side effects or precautions such as allergic reactions, interactions with blood thinners, or increased blood sugar levels. If you have any of these conditions, you should consult your doctor before drinking cranberry juice. Number 2. Nettle tea. The second herbal drink that we suggest for your kidneys is nettle tea. Nettle tea is made from the leaves and stems of the stinging nettle plant, which is a common weed that grows in many parts of the world. Nettle tea has many benefits for your kidneys, such as diuretic, anti-inflammatory, and antioxidant properties. Diuretic means that it can increase the amount of urine that you produce, which can help your kidneys eliminate the waste products and excess fluids from your body. Anti-inflammatory means that it can reduce the swelling and inflammation in your kidneys, which can be caused by infections, injuries, or diseases. Antioxidant means that it can protect your kidneys from the damage caused by free radicals, which are unstable molecules that can harm your cells and tissues. According to a study published in the Journal of Ethnopharmacology, nettle tea can improve the kidney function and lower the blood pressure of patients with type 2 diabetes. Another study published in the Iranian Journal of Kidney Diseases found that nettle tea can reduce the serum creatinine and urea levels of patients with chronic kidney disease. Serum creatinine and urea are 2 indicators of how well your kidneys are working. The lower they are, the better your kidney function is. To prepare nettle tea, you will need dried or fresh nettle leaves, water, and honey or lemon to taste. You can also add some mint or chamomile for extra flavor and benefits. To make the tea, you will need to steep the nettle leaves in boiling water for about 10 minutes until the water turns green. Then you will need to strain the tea and add honey or lemon to sweeten it. You should drink about 2 to 3 cups of nettle tea per day, preferably between meals. However, be careful not to drink too much nettle tea, as it can cause some side effects or precautions, such as low blood pressure, stomach upset, or interference with diabetes medications. If you have any of these conditions, you should consult your doctor before drinking nettle tea. Number 3. Dandelion tea. The third herbal drink that we recommend for your kidneys is dandelion tea. Dandelion tea is made from the roots, leaves, or flowers of the dandelion plant, which is a common weed that grows in many parts of the world. Dandelion tea has many benefits for your kidneys, such as stimulating urine production, flushing out toxins, and improving kidney function. Dandelion tea can also help your kidneys by supporting your liver, which is another organ that is involved in detoxifying your body and regulating your metabolism. According to a study published in the Journal of Alternative and Complementary Medicine, dandelion tea can increase the urine output and frequency of healthy volunteers. Another study published in the Journal of Pharmacy and Pharmacology found that dandelion tea can protect the kidneys from the damage caused by acetaminophen, which is a common painkiller that can be toxic to the kidneys if taken in high doses or for a long time. To prepare dandelion tea, you will need dried or fresh dandelion roots, leaves or flowers, water, and honey or lemon to taste. You can also add some ginger or cinnamon for extra flavor and benefits. To make the tea, you will need to boil the dandelion parts in water for about 15 minutes until the water turns brown. Then you will need to strain the tea and add honey or lemon to sweeten it. You should drink about 2 to 3 cups of dandelion tea per day, preferably before meals. However, be careful not to drink too much dandelion tea, as it can cause some side effects or precautions such as allergic reactions, interactions with diuretics, or increased potassium levels. If you have any of these conditions, you should consult your doctor before drinking dandelion tea. Number 4. Ginger tea. The fourth herbal drink that we suggest for your kidneys is ginger tea. Ginger tea is made from the root of the ginger plant, which is a spice that is widely used in cooking and medicine. Ginger tea has many benefits for your kidneys, such as anti-inflammatory, antibacterial, and antiviral effects. Ginger tea can help your kidneys by fighting off the infections that can cause kidney damage, such as pyelonephritis, which is a severe infection that affects the kidney tissue and the renal pelvis. Ginger tea can also help your kidneys by reducing the inflammation that can impair their function, such as glomerulonephritis, which is a condition that affects the glomeruli, which are the tiny filters in your kidneys that remove the waste products from your blood. According to a study published in the Journal of Renal Nutrition, ginger tea can improve the kidney function and lower the blood pressure of patients with chronic kidney disease. Another study published in the Journal of Ethnopharmacology found that ginger tea can protect the kidneys from the damage caused by cisplatin, which is a chemotherapy drug that can be toxic to the kidneys if used for a long time or in high doses. To prepare ginger tea, you will need fresh or dried ginger root, water, and honey or lemon to taste. You can also add some turmeric or cardamom for extra flavor and benefits. To make the tea, you will need to peel and chop the ginger root and boil it in water for about 10 minutes until the water turns yellow. Then you will need to strain the tea and add honey or lemon to sweeten it. You should drink about 2 to 3 cups of ginger tea per day, preferably after meals. However, be careful not to drink too much ginger tea, as it can cause some side effects or precautions such as heartburn, nausea, or bleeding disorders. If you have any of these conditions, you should consult your doctor before drinking ginger tea. Number 5. Turmeric tea. The fifth and final herbal drink that we recommend for your kidneys is turmeric tea. Turmeric tea is made from the root of the turmeric plant, which is a spice that is widely used in cooking and medicine. Turmeric tea has many benefits for your kidneys, such as reducing oxidative stress, inflammation, and fibrosis. Oxidative stress means the imbalance between the production and elimination of free radicals, which can damage your cells and tissues. Inflammation means the swelling and irritation in your kidneys, which can be caused by infections, injuries, or diseases. Fibrosis means the scarring and hardening of your kidney tissue, which can impair its function and lead to kidney failure. Turmeric tea can help your kidneys by restoring the balance of free radicals, reducing the inflammation, and preventing the fibrosis. According to a study published in the Journal of Renal Injury Prevention, turmeric tea can improve the kidney function and lower the serum creatinine and urea levels of patients with chronic kidney disease. Another study published in the Journal of Molecular Histology found that turmeric tea can protect the kidneys from the damage caused by gentamicin, which is an antibiotic that can be toxic to the kidneys if used for a long time or in high doses. To prepare turmeric tea, you will need fresh or dried turmeric root, water, and honey or lemon to taste. You can also add some black pepper or coconut milk for extra flavor and benefits. To make the tea, you will need to peel and chop the turmeric root and boil it in water for about 10 minutes until the water turns orange. Then you will need to strain the tea and add honey or lemon to sweeten it. You should drink about 2 to 3 cups of turmeric tea per day, preferably before meals. However, be careful not to drink too much turmeric tea, as it can cause some side effects or precautions such as gallstones, stomach ulcers, or blood thinning. If you have any of these conditions, you should consult your doctor before drinking turmeric tea. So these are the 5 herbal drinks that you should drink for your kidney repair. Thank you for joining us today on Health Basics. If you found this video informative and valuable, please give us a thumbs up and share this video with your friends and family. Also, don't forget to subscribe to our channel for more valuable content on healthier living. Stay healthy, stay informed, and we'll see you in the next video.